Good evening. I'm Dr. Fred Rouse, the Real Money Doctor, and it's currently just a few minutes before 7 o'clock on Tuesday, June 9th. And I wanted to recap today's events that affect the way you get, protect, and enjoy your money, your life, and your retirement. Now, the question for today is, what will it look like? And I'll get to that in just a few minutes. Right now, we touch base on the COVID cases every day. That's what's been happening the last 4 months, basically. Actually, since January, depends on what you want to consider the start date. So right now, current COVID cases are 1,973,000. Okay, that's an increase of just under 2,000 since yesterday. Okay. The number of deaths right now is at currently 111,751 deaths. 111,000 people have died so far from COVID just in the last 4 or 5 months, since January, basically. That's another 875 since yesterday, which is not a bad number, but the total number is really obnoxious. It just is. Could we done there? Probably. Are more people to die? Most likely. Now, right now, New York still is the #1 state in the country for the number of COVID cases diagnosed so far. Right now, they're at 379,000 cases. They're up basically 1,000 cases or so since yesterday. So they're on a decline. Their deaths right now are at 30,458. That's a whole 41 more people from yesterday. So they're making some strides, we think. Okay. New Jersey cases right now at 164,796 cases. They're about 300 cases from yesterday. Their deaths are up to 12,303. So another 90 people basically died since yesterday. So they're making strides also. The other states round out the top 10 are Illinois, California, Massachusetts, Pennsylvania at 6, Texas at number 7, Michigan is 8, Florida is number 9, and Maryland is number 10. Now, the states on the coasts that have been hit the hardest have their numbers coming down, okay, but people are still dying. It's the states in the middle that things are happening. Okay, things are happening a lot. Now, there's been a big push for the last 3 weeks now, at least, to reopen the states, and most states have reopened. Some actually never really closed down, depending on where they were. But there's still no treatment. The chance for a vaccine for spread use before the end of the year are really slim to non-existent. And as the rates of coronavirus infections ease in places such as New York and Illinois, and one-time hotspots move now, okay, to open phases. They're starting to reopen parts of these countries that were really the one-time hotspots. Okay, right now, okay, places that had previously avoided being hit by the outbreak are now the new record highs for infections. Since the start of June, 14 states and the highest ever 7-day average of new coronavirus cases since the pandemic actually began. Now, that's according to the Wall Street Post. Okay, Alaska, Arizona, Arkansas, California, Florida, Kentucky, New Mexico, North Carolina, Mississippi, Oregon, South Carolina, Tennessee, Texas, and Utah. If the pandemic's first wave burned through a dense metro area like New York and Chicago and Detroit, the highest percentage of new cases come from those places is with much smaller populations right now is Lincoln County, Oregon, an area of less than 50,000 people, has averaged 20 new cases daily for a while now. The Bear River Health District in northern Utah, they've averaged 78 new cases each day, most of them tied to an outbreak at a meat processing plant in a small town of Hiram. Now, we've discussed the meat processing situation before because, again, these are the main employers in small towns. And when you have an outbreak, they're really not ready for it by a lot. Now, the increase in coronavirus cases continues with fewer than 60,000 people in parts of these areas, and they're really surging across rural United States. These are the places that are least likely to be able to do these things. They were poor for their health care to begin with, having maybe one hospital per county if they were lucky. Okay. And now they're really seriously getting stressed with things. They're not overwhelmed just yet the way New York was at one point in time, but it's not happy for these people at all. Now, health experts worry that those areas that are already short of the resources before the pandemic will really struggle to track new cases, with their existing infrastructure. Okay, they were small towns doing small town medicine, and that's the way it's supposed to be. But you got a pandemic and you throw it on top of things, and they're just not ready. Now, adding to the disparity in healthcare supports, residents in states like Mississippi, Florida, South Carolina were already living under minor to moderate restrictions. As their average daily infection rates were actually increasing. So their rates are increasing. Their governors had already eased up on the restrictions quite a lot, but their numbers keep going up. Now, in the past 2 weeks of the protests against police brutality, you got another variable thrown in the mix right now. How is the virus going to spread now in those areas? Protesters flooded the streets, not only in big cities, but they also gathered in small towns across the country too. Now, the widespread protests were great for the movement, and people are really aware, and it is actually happening in regards to the use of force from police on civilians. However, the health officials also warned about the impact, so many people so closely packed to one another could have on the transmission rates. Right now, most states are not following CDC guidelines on reporting COVID cases. Those states that are not reporting probable cases, according to the daily count listed on the CDC's website, probable cases include those that show evidence of an infection without the confirmation of a lab test, and cases where COVID virus was listed as a cause or contributing factor to the cause of death, but are not confirmed again with a lab test. Now, states had routinely included those numbers, and people thought the numbers were inflated. Well, they're not inflated. Some of the states with the largest populations, like California, Florida, New York, and Texas, are among those listed that are not reporting probable cases. These guidelines, that should be included in that case count. Now, that comes as 26 states see an increase in a steady rate of new cases. Accurate rates of new cases are among the metrics that help really officials track how the disease is spreading in the U.S. and how to make decisions about reopening and loosening restrictions, and what mitigation things to put in effect. Now, although coronavirus cases reporting the guidelines are voluntary, they are, but states are not reporting probable cases and are likely to undercount the number of people that are infected, and make it really difficult for officials to get a real true picture of what's going on in the nation. In the midst of the pandemic, this has rocked every aspect of everyone's life. What about the schools? How and when will students actually start to go back to school? It's been a question for a while. People weren't happy with they shut the schools, but they saved a lot of lives, most likely. But they've got the summer now to try and figure this out. The schools have been especially upended, with students across the country not being, on campus for several months. It's killed graduations in both high schools and colleges. While many local governments has expressed, a path forward for the fall, it's still unclear. States like North Carolina, California have released guidelines for reopening the schools. So California's got 1,000 school districts and will make its own decision on how exactly to open those districts and resume in-class learning. Okay. The state's Department of Education released a 62-page guideline, okay, Monday, on how to help them plan ahead of time. The guide gives options for staggering schedules, ongoing distance learning, and models that combine both. And it also directs educators to teach proper hand washing and limits the number of students allowed on buses to prevent the virus from breaking out. State Superintendent Tony Thurmond said the guidance is only as good as what's implemented. We expect it will be adjusted as we go. Now, in North Carolina, the governor there, Roy Cooper, also released health guidance for reopening schools Monday, telling reporters that this school year will be different than any other school year so far. Students and staff will be screened for illness before they enter the school. Children will be distant from their classmates. They won't be sharing pencils or textbooks, and there will be a lot of cleaning. Now, the North Carolina Secretary of Health and Human Services, Dr. Mandy Cohen, said that she's concerned the state's positive tests are among the highest in the nation. Okay. This is the director from the state. Okay. These trends are moving in the wrong direction, and it's a signal we need to take very, very seriously. Well, North Carolina is really seeing an increase in cases. California, with its trends are basically holding steady, is beginning to reopen some recreational sites. The state has also been among those most affected. Is the home of Yosemite National Park, okay, which has been off limits to visitors now since March 20th. They plan on reopening it on Thursday to the public, and it will aim to admit about half of its average rate of visitors, beginning by allowing only 1,700 vehicles a day, according to a statement from the parks. Now, Acting Superintendent Cecilia Muldoon said, "There is no place like Yosemite, and we can't wait to welcome visitors back. It's going to be a different kind of a summer, and we'll continue to work hard with our gateway communities to protect community health and to restore the access to Yosemite National Park." Now, as early as Friday, indoor California movie theaters may be reopening. Okay, according to guidance from the California Department of, they released that statement on Monday. Now, theaters are required to maintain a 25% capacity, or a maximum of 100 attendees, whichever is lower. Okay. Theaters will also need to reconfigure their seats to ensure physical distancing between moviegoers, who must all wear face coverings when not eating or drinking to mitigate virus spread. Now, that's going to be interesting, and you know how it goes in a movie. Are you going to put a mask up, take a sip, put a mask back on again? Probably not. So we'll see what happens as this happens. As many of the hardest hit states begin to recover from the pandemic, the cases are rising elsewhere. New cases are back on the increase. Had an outbreak reported on Friday with at least 62 people infected near Winooski. Okay. Now, according to Vermont Health Commissioner Dr. Mark Levine, he said dozens of children were among those infected, and more than 1,000 people in the state went to get tested following the outbreak. In Vermont, state epidemiologist Patsy Kelso said that the outbreak was spread by friends and relatives, and through contact tracing, it appears to be well contained. But again, they had an outbreak. They weren't really expecting it. And that's what's going to be happening in the near future. You think things are going along fine, and all of a sudden, bang, you have an outbreak out of nowhere. And the people that are affected are getting seriously sick. Now, in Utah, State Representative Suzanne Harrison called a recent spike of cases very concerning and approaching exponential. The positive test rate doubled one day to the next to 18.5%. She tweeted, the Utah State Department of Health tweeted, "When you're away from home, please avoid close contact with others and wear a mask when social distancing measures just aren't feasible." in just the last week, Texas and Arizona have had spikes, okay, in cases, both reporting more than 1,000 new cases each in one day. Several universities have also reported new cases within their athletic programs, including Arkansas State University, Auburn University. So these things keep going up. Okay? They keep going up every day. And these are areas that weren't really hit all that hard to begin with. But as the reopening continues, you're going to see more and more of these things happening. Now, the unemployment numbers came out on Thursday, and they looked great Thursday morning, but they shocked economists because they were too good. And as they started to go through them more, they found they weren't anywhere near as rosy. Okay, and there was a problem with the way they were counting certain things. People that were furloughed and temporarily back to work and not back to work, and there was an improvement, but not anywhere near as good as it had looked. Now the stock market had a rally, okay, and closed above 27,000 on Friday. Okay, here we are on Tuesday. It's still above 27,000. They took a hit about 300 points today. Okay, and it's relatively normal. It goes up, it goes down, it goes sideways for a while. Okay. U.S. had its worst downturn since the Great Depression. People are officially calling this a recession at this point in time, according to the Bureau of Economic Research. Okay, and then you saw the disconnect between Wall Street and Main Street. Okay, and that's going to continue for a while because a certain group of people, basically the 2%, have tons and tons of money and nowhere to put it other than this. Okay, they're not going to leave it in their mattress, trust me. Okay, and they're very happy to take 3 or 5% return on several $1 million and call it a day. But the rest of us are not quite in that position. So that really brings me to the question of today. Okay, what will it look like? Okay. As more and more states continue to open parts of their economies, what will life look like in the new, not quite post-COVID environment just yet, because this hasn't quite finished yet. And we're expecting to see more cases in the fall, obviously. And again, you get the center of the country right now that's having some problems. They're seeing hotspots by a lot. Now, we're already seeing some of those social changes right now. Okay, social distancing, a term we didn't even know existed 6 months ago. It's now really commonplace. Okay. Wearing masks is also likely to be a new norm for an extended period. There's really likely to be at least one more stimulus bill passed through Congress as the Fed tries to figure out what they're going to be doing for the rest of this year and next year. Now, as I said in the beginning of all this, way back when we got started 2-3 months ago, whenever I started doing these things again, okay, most of us are going to make it through, and most of us have. And life is still going to go on, and life is going on. Okay. However, it has changed considerably, even as it progresses. And if you had problems before all of this, the past 5 months have only really solved those problems. If you were 50 plus in December and hoping to retire at some point, you're still trying to figure out how you can retire at some point. Only now it's 5 months later, so you have 5 months less to try and figure out how to make it happen. You have a very, very short window of time, okay, to do anything that's going to make a substantial difference in the lifestyle that you really want to have. Okay, and putting you in a position where you don't need to be working well into your 80s if your health holds up that well. Now, most financial planners are very, very willing and eager, actually, to sell you one's life insurance annuities so they can get the commissions. And they understand that, and you sort of have a feeling for that. They know, however, that none of those things has any real chance of making any substantial difference in your retirement. And down deep, you know it too. You'd like to hope that it would, but you know better than that. You're 50 plus already. You've heard all this stuff before. You're not going to get rich overnight. There are no unicorns. Okay. Now, if you run into somebody who's a little bit more honest, they're going to tell you that it's too late for you and that there's actually nothing you can do but cut back your lifestyle and keep working. And that's what they're going to tell you if you find somebody who's actually that honest. For the most part, they're not. They're going to take your money, churn it into something, get commissions out of it, and just, okay. And you might feel a little dejected at this point in time. Because again, what do you do at this point in time? Some people are going to tell you it's just too late. I'm here to tell you it's not too late. It's not too late for you. I'm a retired certified financial planner and a multiple best-selling author. I spent the last 40 years working with select individuals, small businesses with 0 to 6 employees. I've shown them how I turned $5,000 into $57,000 in just 1 year without leaving the house. And I can show you too. I can. Okay. I can show you how to get control back of your life and get the cash flow that you'll need to retire in just 3 to 5 years from now. Now, I can't help everyone. And the program is really not for everyone. But I may be able to help you. So go to my site, drrousenow.com. There's a 12-minute video there that explains the program. If you're remotely interested, schedule a call. We can at least talk to see if I can help you or not. Doesn't cost you anything. Okay, you can't buy anything on the call. There's only one reason for the call. I just want to meet or not. If you do, can I actually help you or not? Because I can't help everybody. And the third thing, do we think together, jointly, that we can actually work together to make this thing happen? Okay, that's the only reason for the call. And again, you can't buy anything on the call. Now, I'm Dr. Fred Rouse. I'm the Real Money Doctor. Okay? My only goal is to help you get, protect, and enjoy your money, your life, and your retirement. Now, I appreciate spending some time with you tonight, as I do whenever I come on. And I really look forward to seeing you again tomorrow around 7 o'clock or so. The video on my YouTube channel, The Real Money Doctor, tomorrow. Like and share the video whenever you see it, either on Facebook or on YouTube. And again, I look forward to seeing you again tomorrow around 7 o'clock. Thank you.